Hello, the CentraCare Health Urology team would like to welcome you to your online learning module. CentraCare Urology is a leader in urologic services in central Minnesota. We pride ourselves on excellent outcomes and creating the best experience possible for our patients. We perform a variety of state-of-the-art procedures to ensure our patients are receiving the most advanced services possible. Our experienced staff includes a multidisciplinary team of physicians, physician assistants, nurses, and a variety of care and support staff to assist you through every step of your surgical experience.
Hello, my name is Bill, and in this module a variety of topics are covered. You'll be able to select the topics that apply to you. While viewing the module, you may pause the video at any time and replay the information as often as you like. The topics covered include anatomy and general information on types of surgery, caring for urine drains using the Foley catheter, caring for surgical drains using the Jackson-Pratt or JP, what to expect when you go home from the hospital, and information on exercises, physical activity, and sexuality following surgery, information on patient support and support groups. But before we begin, we think it's important to understand exactly how your body works. So please watch this brief overview of the basic anatomy of the urology system.
The male urinary system is made up of the kidneys, which produce urine, the ureters, connecting the kidneys to the bladder, where urine is stored, and the urethra, the exit passageway from the bladder. The male genital system begins with the two testes, where sperm are produced. The epididymis is a system of convoluted small tubes leading from each testis and emptying into the vas deferens. After being joined by the duct of the seminal vesicles, the vas becomes the ejaculatory duct, which enters the prostate, where it joins with the urethra to convey the sperm, contained in semen, to the penis. The walnut-sized prostate gland is situated just beneath the bladder and encircles the upper part of the urethra. It secretes alkaline fluid rich in enzymes and prostaglandins. This secretion is important to the survival and performance of the sperm. The seminal vesicles also play an important role in contributing secretions which enhance the sperm's chance of success. During ejaculation, the connection between bladder and urethra is closed, while the prostate, seminal vesicles, urethra, and the penis all undergo rhythmical contraction, moving forward the semen, which is composed of sperm plus secretions from the prostate, seminal vesicles, and minor glands. The aging male is prone to develop enlargement of the prostate.
There are a variety of treatments for urological issues. In this section, we'll provide an overview of some of the surgical procedures that we offer, including the Da Vinci surgical system, which enables surgeons to perform operations through a few small incisions and has several key features, including magnified vision system, that gives surgeons a 3D HD view inside the patient's body, ergonomically designed console, where the surgeon sits while operating, patient side cart, where the patient is positioned during surgery, wristed instruments that bend and rotate far greater than the human hand. The Da Vinci system is powered by robotic technology that allows the surgeon's hand movements to be translated into smaller, precise movements of tiny instruments inside the patient's body. One of the instruments is a laparoscope, a thin tube with a tiny camera and light at the end. The camera sends images to a video monitor in the operating room to guide doctors during surgery. The surgeon is 100% in control of the Da Vinci system at all times.
To understand what is going on in your bladder, a cystoscopy may be done. This is done by inserting a thin instrument called a cystoscope into your urethra. The urethra is the tube that carries urine out of your bladder. The cystoscope travels up your urethra and into your bladder, allowing the doctor to look at the inside of your bladder. Cystoscopy may be done alone or along with another procedure. When only a cystoscopy is done, a numbing medication is used at the insertion site, and the procedure usually takes less than 5 minutes. When a cystoscopy is done with another procedure, sedation or deep anesthesia may be used. The length of time it takes to complete the procedure varies based on what other procedures are being done. Problems such as urine leakage or incontinence often happen because the muscles and tissue that support the bladder and control urine flow become weak. A procedure called a suburethral sling may be done to support the muscles and tissue. A suburethral sling procedure makes a small incision and places a mesh-like material under the urethra, cradling it, similar to placing the urethra in a hammock. The sling supports the urethra and helps prevent urine leakage when you laugh, cough, or use your belly muscles. A suburethral sling procedure is done under local or deep anesthesia. The procedure takes less than 1 hour, and in most cases, no hospital stay is needed.
Pelvic muscle exercises are exercises that strengthen the muscles that control the flow of urine and bowel movements. These exercises are also known as Kegel exercises. They can help keep you from leaking urine, gas, or bowel movements if leaks are a problem for you. Both men and women can learn to do Kegel exercises by stopping and starting the flow of urine. After you learn which muscles to tighten, you can do the exercises in any position, sitting in a chair or lying down. You do not need to do them while you're in the bathroom. Do the exercises at least 6 times a day. Each time, flex your muscles 8 to 12 times and hold them tight for 6 to 8 seconds each time you tighten. Keep up this routine for at least 1 year. You'll probably notice results, but it might take a little time. Kegel exercises can be very helpful to your recovery. They help reduce urine leaks in people who have stress incontinence, which means they leak urine when they cough, laugh, sneeze, or strain. Control sudden urges to urinate that happen to people with urgency incontinence.
I am having urine leaking after the catheter was removed. What could I do to decrease the chance of leaking? A. Do jumping jacks 5 times per day. B. Walk long distances. C. Sit in a chair for long periods of time. D. Do pelvic muscle exercises, also known as Kegel exercises, 6 times per day. The answer is D. Do pelvic muscle exercises, also known as Kegel exercises, 6 times per day.
Being constipated typically means having difficulty with bowel movements or infrequent bowel movements. Almost everyone has some degree of constipation in his or her lifetime. Although it's not usually serious, people often feel better when their system is regular. Some of the most common causes of constipation can include pain medication, recent surgery, limited mobility, dehydration, and a poor fiber diet. Treatment options that are typically used include an increase in water intake, high fiber diet, and stool softeners such as Colace and Miralax. In circumstances that severe constipation occurs, treatments like laxatives or enemas may be necessary and help relieve abdominal pain associated with constipation. If you're not passing any gas, have increased nausea, or your abdomen is distended and you're unable to have a bowel movement, contact your provider for further instructions. Your provider will often prescribe medications to you to help prevent constipation related to recent surgery.
I am having constipation. What can I do to help relieve this? A. Take a stool softener and drink more water. B. Drink more soda. C. Sit on the toilet for lengthy periods of time. D. Take more pain medication. The answer is A. Take a stool softener and drink more water.
Exercise and activity are very important after surgery. You'll be encouraged to get out of the bed and move the same day as your surgery. This is under the direct supervision of nursing staff. Your first time out of bed will be with the assistance of 2 staff members. You're given many medications in surgery that have side effects that can affect your balance. We don't want you to become dizzy and fall. After your post-surgical vital signs are completed, staff will encourage you to dangle your feet over the edge of your bed in a sitting position. They'll give you detailed instructions on standing and moving. This process is slow, with resting points during each step to ensure you're strong enough to move further without the risk of falling. The best thing to prevent blood clots is to get up on your feet again and walk. In order to prevent blood clots in the hospital, you'll be encouraged to move and pump your legs every hour while you're awake. You'll also be encouraged to cough and deep breathe after surgery. This means you need to take a deep breath to fully expand your lungs. This should be completed every hour while you're awake. The deep breaths often cause coughing as the lungs expand. The lung expansion helps to prevent pneumonia and other breathing complications that may occur after surgery. Nursing staff will remind you and encourage you to complete these exercises.
What kind of activity is expectable after surgery? A. Walking around the house. B. Deep breathing. C. Pump your legs and move your feet while you are awake. D. All of the above. The answer is D. All of the above.